Hello. I'm yawning. It's Monday. All right, we're doing another episode of Carpools and Cannulas. I'm Dr. Jennifer Greer from Cleveland, Ohio. Dr. Gallus from San Diego, California will be here momentarily. We have a good topic today. We're talking about tattoos and body piercings. Hey!
Hey,
How are you?
good. Yawning. It's Monday only.
Me too. I may have just woken up from a nap. It's entirely possible.
Naps are good.
Naps are very good. My cat was like needing me though. He's like, no, wake up, belly rubs.
That's awesome. Did you have a good weekend?
I did. It was, yeah, it was nice. I got to hang out with my best friend's new baby. He's all of like 3 weeks old and he's like this big.
Oh, that's adorable.
So cute. And I totally didn't want another one. So it was even better.
Yeah. You're like, okay, here you go.
Yeah. I'm like, he's so cute. Oh, he's awake.
Yeah.
How was
That's
your weekend?
Oh, wait, never mind.
Yeah. Can you hear me now? No, sound's going out. Okay. Oh, hey, Rosie, I see you're watching. Good to see you. How's your connection? Oh, she froze. Okay, hopefully she'll leave and come back. Or maybe it's my connection that froze. Let's see. All right.
Okay, sorry.
Oh, there you are. I didn't know if it was me or you. It just froze.
It was me.
Okay.
It's having multiple different people owning AirPods in the house. And so.
Oh, they're all connecting to your phone. Yeah.
Yeah, so my teenager's AirPods just hijacked this awesomely. So sorry, everybody, about that.
That's okay. Often I'll be like on a call or something, and then my son will open my iPad, and my iPods will connect to that, and then I'm hearing like Roblox. It's great.
Yeah, it's awesome. So you got a new tattoo. Yes, very nice.
The needle driver for you guys who are not surgeons, which is what we used to suture, and yeah, I like it.
Looks good. Very nice. That's
fun.
So we're going to talk about tattoos today, right?
Yes.
Removal.
Since I keep getting them, I've got one over here too.
Oh, nice.
Mm-hmm. Yeah, which is fun. They're actually really hard to remove. Sorry, guys. I know everyone wanted to know that we could take them off easily, but not really.
Yeah. So old school way to take them off was dermabrasion, I think, way, way back in the day.
So basically, you're just sanding off skin down to where the pigment is.
Yep. And then letting that pigment, the ink leach out. Then hopefully your skin heals. Then you do it again. Ideally, you don't scar from that, which is a possibility, unfortunately.
Yep. So, if you guys hear a weird popping sound, it's the cat behind me clawing the exercise mats.
Oh, good. Okay.
Very loud. Okay, stopped. Yeah, so that didn't work right. If it's small, we can excise it, and that's easy. I've taken actually big ones off the neck just by doing a neck lift. I did have someone send me a picture of a whole shoulder tattoo. I was like, that would be an arm amputation.
Yeah, so it depends on the location for sure. I've taken them off the wrist a handful of times, no pun intended, which can be easy or hard depending on which way it's oriented, how big it is. It's going to leave a scar. I took one off for somebody who was trying to hide it from her parents. She had, I don't know, her parents didn't live in this country and she'd gotten the tattoo and then she wanted it removed. And then another one for a Marine who had, was trying to become an officer. So going from enlisted to officer, and he figured that they told him that tattoo was going to hold him back. So he had one on, they don't like them below the
elbow. Oh
yeah. Elbow.
I was like, so many people have tattoos now.
I know, but you know, the military takes its time catching up to stuff. So for the longest time, you couldn't be a pilot if you had like LASIK or PRK surgery. Like,
yeah.
No go.
Oh, they finally stopped that because everybody's had LASIK.
Because then they'd have.
They're like, oh, and we're out of pilots. I know Hobby Lobby finally started allowing visible tattoos. One of my friends is a manager there. So, They're catching up too. Yeah, so I mean, you can excise some of them. You can laser. It's odd. You know, Sciton has such an amazing laser platform. And Sciton, if you're watching, I've told you this before, there's no platform for tattoo removal on their laser.
There isn't?
No.
There's no Q switch?
No.
Huh. So do you do laser tattoo removal? Because that's what you have as a Sciton, right? So you don't have
I have a Sciton. I don't now. I've thought about adding another laser at some point because a lot of people do call. I mean, I know it's tough with all the pigments. You know, if it's black, it's one pigment, but with multicolored, it gets a little trickier.
Yeah, so laser tattoo, I have a platform, the Spectrum by Roar. It has a couple of different options, but there is a Q switch that handles it. And it takes a lot of energy to break down the pigment. The pigments like black are the easiest to disperse. And then it takes a lot of treatments. And so the first few treatments, you get the most like change. You really see things fade, but then to get it to like not there, magically disappeared, is almost impossible. You just keep getting a little bit better each time, and it's really tough. Yeah. So, and then sky blue is like brutal too. That's one of the pigments that doesn't come off real easy. So
I didn't get a cover-up tattoo, folks.
Right. So that's actually a lot of people who have tattoos that they hate successfully are just trying to lighten them so that they can do a cover-up, so that they can tattoo over it. That's a common idea because you're never going to get it to completely go away. And then you just have a faded tattoo, and then you might as well just design something else you like over it. There was a quick minute where people were doing tattoos with an ink that was supposed to be able to dissolve if you hit it with a certain light or something, but I don't think it ever caught on. That would be cool because you could tattoo up and then maybe reverse it later. Yeah.
I mean, they're so common now. Like I had a 71-year-old come into my office with a big new shoulder tattoo.
That's pretty cool.
It was awesome.
I just saw somebody posted about this in like a doctor's Facebook group about whether it was appropriate to have tattoos as a physician in clinic and if it would hurt their career. And pretty much everybody on the thread was like, already have one.
No, what are you talking? I got a new one. Yeah, it really used to be. I mean, even when I was in med school, that's longer ago than I like to think, but 2003 to 2007. So we're talking like 15 to 20 years ago. Like visible nose rings were still long hair on guys was still
Yep.
And now we were talking about this today. We're like, okay, the anterior neck tattoos are still a little edgy in the face.
Yeah, so maybe the teardrop.
Yeah, like those, but you can go neck now and not be looked at twice. You can even go hands. I've seen like a lot of very dainty finger tattoos. Yeah, when I was talking about getting my nose pierced, I was in the OR. I'm like, what do you guys think? And half the room was like, our noses are all pierced. We all had masks on. I'm like, oh yeah, how about that?
Right? Yeah, it's pretty common.
Yeah.
Yeah,
but I mean, it's all like women my age or older too. We're not talking like 20-year-olds. So yeah.
So
I think the easiest tattoos to remove, by the way, are if you get like the lower hip in front, comes off with the tummy tuck. Those are easy.
Yep, definitely. Yeah. Anything in your lower abdomen is going to come off with the tummy tuck if you don't like it later.
Yep. Shoulders, forget it. Same with like legs.
Yeah. Nothing on the leg is going to come off.
Are you just going to sit here and meow? He's meowing. So come here. Come on. He did this. I had a Zoom meeting yesterday, and he's like, I'm just going to sit and meow and then knock over your plant. He's very helpful.
Yeah.
Very helpful cat. Yeah, so tattoos are tough to remove. Sorry for that news, but my mom definitely told me they were permanent and that I should never get one. So,
right. Those are just, make sure you really like it or you're willing to tattoo over it, I guess, is the moral of that story. Plastic does not have some magical answer. I do know that there are some lasers that are better at it than others. And there's some I think the Pico Shore laser is supposed to be like designed exclusively. I mean, its original purpose was to take out tattoos, and now it has other indications. But beyond that, and even those aren't perfect. But if you have a really tough one and you really want it off, you have light blue ink or something like that, then maybe seek out somebody who has a Pico Shore.
Yeah, and then get a cover-up tattoo.
Yeah.
Yeah, which is, you know, not the worst thing in the world. Now, piercings we're better at. Piercings we can handle. Now, okay, so here's something that's interesting, because when I was in med school and then in residency, all piercings had to come out for surgery, right? I mean, that was a huge thing. And the reason we always said that was because we use cautery, you have a grounding pad, their current could travel to your piercing and cause a burn. Has that stopped for you guys too? I feel like we kind of like take out the easy ones, and then if it screws in or can't come out, or I don't know, it's just really hard to get back in, then we just leave it.
Yep. If you're more conservative, you'll tape around it.
Although I don't even know what that does.
I know.
The current's coming from inside the body, not outside.
I know. I think if it's like a ball and it's sitting on the skin, and then, you know, the burn on the inside you might not see, but if it's going to make contact with the skin and that metal heats up, I guess the idea is to protect it from that. But yeah, so we've started just taping them because they're so, unless they're like directly in the field. And I think the farther away from the field that you're operating in, so if you're, you know, doing breast surgery, the belly button piercings, not a big deal, although those are easier to take out, obviously.
Yeah. Although I always thought it depended too on where your grounding pad was, because if your grounding pad was on the thigh, you're cauterizing on the breast, theoretically the current's traveling right past that piercing.
Correct. That is true. That's another variable.
Yeah, although I haven't really seen good literature on like the rate of piercings. I can tell you that most of my patients have piercings also, and those do seem to stay in.
A tough one, I think, that people have a hard time removing, which I think is controversial for us as plastic surgeons, are the nipple piercings, right?
Yes, I was actually just going to bring those up. And I've had patients, if I'm doing an aug, I just have them switch out for a glass or silicone rod, or a plastic rod, and then we just prep them in. Yeah,
because again, now it's just in the field that you're working with. But apparently those piercings close up really quickly.
Yes. Right? I've also offered to patients to like put them in at the end of the case, but lately I've just had them go get like a plastic one and put them in. I've also pierced nipples at the end of a case for patients.
Just
like they were getting an aug and they were like, well, if I'm under.
Oh, can you pierce?
Yeah.
When you're all said and done, I guess that would be fine.
Yeah. Yeah, I mean, it's all prepped. It's all sterile. You get a 14-gauge angiocath, which is what you start an IV with. Poke it through, pull the needle out, put the barbell in the cath. And
they BYO earring? They bring their
yes, I did have them go bring their own earrings. I don't keep those in stock. I don't even keep 14-gauge angiocaths in stock. I had to order those, but.
Let me bring out my assortment of nipple piercings.
Yes, it's in this back drawer. Although I had an attending when I was in medical school joke that he was just going to open a piercing shop when he retired because he could pierce like literally anything.
I guess so. They do charge a lot. My kids have their ears double pierced and iffy on the triple piercing because they can get their mom to do it. They like aren't super compliant with the, keeping it in. Like I think I did a triple piercing on Gabby and then she took him out that afternoon for a soccer game. And I'm like, you can't do that. It closed.
Yeah. They close fast. Yeah, I should probably charge more actually. When I got my nose ring, it was like $60 and I only charged $50 for ears.
Right. So my point is when I first looked into getting a second piercing for my kids, I looked at, I live in Pacific Beach in San Diego. So there's like tattoo and piercing shops like everywhere. And one of the places that was known for like you could bring your kid there to get a double piercing was it's called Enigma, but it was like $150 once you bought the earring and had them do it per kid. I've got a lot of kids, so I'm not rolling out, and I think it was per ear. So I'm like,
wow.
Yeah, it was like, I was like, let me just see what I can find on Amazon.
Yeah, I use the Inverness. It's a little piercing gun, but it's not spring loaded. You just squeeze it, which is great for ears. And I've done cartilage too with that.
Cartilage?
Yeah, I've done cartilage with it. The earrings are pretty sharp. They've done well. I mean, I sure wouldn't do like a tragal piercing. And then nose piercing, they have, I was totally checking it out as the tattoo artist was like loading it up. And they have like a hollow backed needle that the post of the nose ring goes in.
Oh, okay.
So then she just like preps her nose, sticks a cork in there, sticks the needle through, and then, really a cork, Because, I mean, I guess she didn't want to stab my septum or her finger, which I appreciate. And then she like pulls the whole needle through and pulls the piercing through. We're about to have a cat enter the field of, really? He's like blocking my whole screen, but you can't see him. This is Mr. Spots. He's very large. He likes belly rubs and rubbing on my phone. Yeah, so then she just like pulled it through.
And so what's the backing on the nose piercing?
It's not. It's like a little, it goes straight and then it corkscrews around.
Oh, right.
Yeah, so you can see inside, you can see the little, so like when you pull it out, it's only part way out and the post is really long and then you have to like unscrew it.
Got it.
I always wondered that.
I have one of those. I mean, I probably could still jam one in through my old piercing. I was just curious because I pierced my nose myself when I was in college.
Yeah, I did my belly button in high school, so we're on the same page.
Yeah.
Yeah.
Just nice. But it's better, I think, if you have the tools. Anyway, yeah, and it was like the little corkscrew one.
Yeah, and you just have to. I always wondered that. I'm like, how do you put it back on it? It just.
Yeah, the needle. I think I just shoved a needle through and wasn't.
Did you? And then put the earring in right after?
Yeah.
And you didn't hit your septum because that would really hurt.
Yeah. No, I did not. So, I mean, it's better to be lucky. than good.
I was not lucky. Both times I pierced my navel, it got infected. My sterile technique apparently wasn't awesome with like a safety pin.
Yeah, I used to put safety pins through my earrings, piercing holes. But they're already pierced, so that's fine.
Right. That's different. By the way, safety pins are not that sharp. Not really.
They are.
Yeah. Yeah. Oh, and how about the dermals? Like those are like inserted into the skin. I'm not sure how they're inserted. I haven't seen them inserted, but they have like these prongs and they're like under your skin and you can't remove them unless you surgically excise them. Right.
So you have to go in and then they sort of deploy. Belly button, eyebrow, tongue, and lip. I've had my belly button pierced and I definitely had my nose pierced. And then I joined ROTC in college because I was on my way to having my entire face full of metal. Like,
and they were like, you need to stop.
Yeah, this will rein it in. Eyebrow, tongue, and lip. Yeah, so the thing about the facial piercings, the dermal piercings, and I've seen one right here, which is kind of cool, is when you take those out, those holes are there. There's no...
Yeah, you have to excise them and close it, and then it leaves a scar. Well, even the lip piercings I've seen, they look almost like a dilated pore. Like you can see the hole. And I imagine, I haven't excised this, but I've excised ear piercings this way. You just take a little biopsy punch, core it out, and stitch it up, I would guess.
And then you'll just have a linear scar. Because they were kind of popular to put right here.
Yeah.
Yeah. And as a matter of fact, the belly button scar piercing is, I mean, I feel like it's almost ubiquitous at this point in women our age or my age and younger, your age.
My 6-year-old's calling. She'll just, oh yeah, like everybody has them. They come off with tummy tucks. My 6-year-old's calling, so if she calls like 8 more times, then it's because she doesn't understand voicemail. Yeah.
Yeah, so, but I've struggled with, that's okay. I struggle with people who have the belly button piercing and they don't want a tummy tuck. Like that's hard to like, or they don't need a tummy tuck. I mean, you can kind of ellipse it at the top, but but
the scar's a lot more visible.
Mm-hmm. Whereas everyone's like, oh, you had a piercing.
Yeah, it's pretty visible. I always wondered if you could, because you know, it ends up being like this little flap of skin over the piercing. It's not so much a hole as like a little flap of skin. And I always wondered if you could just cut that off and have 2. I'm not even kidding. That was 4. 4th time. She called 12 times last time I didn't answer.
Oh.
Well, I was outside. I was putting mulch down. I come in. There's 12 missed calls. I'm like, oh my God, are you okay? She's like, you didn't answer your phone. No, babe. I was outside. I didn't have my phone. Hi, Justin. I told you I'd say hi if you jumped on. And she just keeps calling. I'm like, honey, I'll call you back when I can. I can't always answer my phone.
Yeah. At least she's not FaceTiming you. I think that would probably blow this up.
It would. Like, yeah, she has a watch, so she can't do it. It's just like one of those little watches so they can call and text.
Oh, yeah.
Yeah.
Absolutely.
Okay. 7 more times and she might stop. She calls me Saturday. She's like, Mom, I have good news and bad news. I'm like, oh, what's the bad news? She goes, we're out of milk. Oh, okay. I'm terribly sorry. 8 times. See, guys, this is what it's like to be a mom and a surgeon. You're trying to do an Instagram live and talk about your history of belly button piercings, and then your 6-year-old calls you 8 times. Oh, yeah, so piercings are pretty easy to excise is what I was actually going to say, but except for the belly button ones. Those are tricky.
Yeah, and the ones that you would think would be harder, like the plugs in the ears where there's
those are not hard. Yeah, those are pretty easy.
And the scar hides really well. I would say I haven't seen anybody come in with the huge ones that are in the side of the face. Those are
like the hole through the chin.
But I think they're so rare that it hasn't become an issue.
Yeah, I suspect those ones are more like displacing the tissue than actually stretching it, like in the ears.
Hmm. So maybe when you take them out, it shrinks down. I don't know.
Yeah, I don't know. How about the lip one? I've never had to repair one of those. That would be multi-layer. I mean, you got the mucosa, you got the muscle.
Yeah, they go all the way through.
Yeah.
Then you're getting crazy. But yeah, I think the rest of them are pretty easy to excise. The ones in the earlobe with the giant plugs sometimes need a little bit more finesse.
Yes, and I usually end up removing part of it, and then you just kind of bring it all together and like wind it back into an earlobe and call it a day.
Yeah, a million sutures later, it's fine.
Yeah,
so
totally fine.
Heal really well without much of a scar.
Yeah, earlobes do heal well. I'm trying to think, what's the weirdest piercing you've ever seen?
It's not really a piercing, but there was a guy when I was deployed on a ship a long time ago. He was on one of the other ships, and he was kind of like a medic, and he got in trouble because he was doing minor procedures on the ship. He was excising tattoos. That's a no-go if you're not really a credentialed provider. And then he was making little incisions on the dorsum of the penis and inserting like small pearls or beads there, and then some back up.
You just let some random guy take a knife.
I mean, it's the corpsman. Like, what could possibly go wrong? Yeah. So out window that was shut down. But yeah, that's that would be the weirdest little.
I feel like that would not heal well.
It has the potential to go very wrong.
Oh my gosh. Now my daughter's calling my son's watch, which he left here. I'm like, what is ringing? This is
my nephew has used that watch back when he had one. He's a little bit older now, so he has a phone to call my sister in the middle of the night because he woke up and he didn't see her. She had moved bedrooms because her husband was sick and coughing, so she went to the guest bedroom and he woke up, went in their room and wasn't there, and like her phone started ringing, and he's calling her because he didn't know where she was in the house.
Yeah, I'm gonna have to work with Ella on like, mommy can't always answer the phone, and I will call you back. I'll call you back. That will be our conversation in about 5 minutes.
Now we're freezing.
Are we? Oh.
Okay. Well, we should, if anybody's interested in hearing other topics, please put them in the comments or DM them. But yeah, we should pick something for
2 weeks from now. Yeah. I'm trying to think, what have we not talked about?
I mean, we kind of covered everything, but we could talk about, I don't know. Have we talked about hand rejuvenation at all?
Not lately, and there's some good stuff out there.
Yeah. And I don't have any experience with the new cellulite tool thing. Oh,
no, the one that's supposed to replace Selfina, the new gadget. Yeah. I don't, do you?
No. All right. Well, maybe we can suss that out more. But yeah.
Yes. All right, cool. So we'll see you guys in like 2 weeks, and we'll talk about hand rejuvenation and maybe some cellulite. It'll be good times.
All right. You have a great night, and good luck with your daughter.
Thanks. I'm going to call her right now. Good to see you.
Okay. All right. Bye. Bye.